In the last 24 hours, a total of 74 samples from suspected cases of coronavirus have been tested in various laboratories, namely the National Influenza Center, KEMRI Nairobi, KEMRI Wellcome Trust Kilifi. Out of the 74 samples, we have received confirmation of 3 people who have tested positive for coronavirus disease. This brings the total number of confirmed COVID-19 cases in Kenya to 31. These 31 confirmed cases are spread out in 5 counties, namely Nairobi, Kajiado, Mombasa, Kilifi, and Kwale. All the 3 new confirmed cases are Kenyans, females aged between 30 years and 61 years. The 3 cases are close contacts of previously confirmed cases. 2 are from Kilifi and 1 from Nairobi. The new patients have already been taken into isolation in our facilities and are being monitored by our medical personnel together with others who previously turned positive. Tracing of contacts for the new patients, as well as those of the previous patients, is ongoing. The total number of close contacts that we have so far stands at 1,029. Out of this number, 123 of them have been discharged after completing the 14-day follow-up period. We are now remaining with 906 close contacts that our contact tracing teams are monitoring. 18 individuals are currently admitted at Mwangangi Hospital awaiting tests. As we speak, there are consultations going on how our teams are going to handle Kilifi and other areas that are emerging as hotspots. I therefore urge people at the coast and Kilifi counties in particular to observe social distancing with self-determination. There are more than 2,000 people who arrived in the country from Monday this week, and we have placed them under mandatory quarantine. These individuals shall be tested in due time in line with guidance from the World Health Organization. Concerning the curfew, indeed, the President put in place a curfew, and this curfew is a measure of strengthening the messages that we've been relaying to the public. Social distancing, ensuring that physical distancing is our first guard as a weapon. Why this was needed and why this was needed to be emphasized is because we've noticed, despite putting in place instructions, Kenyans have not been adhering to this. We have reports coming in that people are still congregating in clubs, in restaurants. We have reports coming in that people are holding house parties. That is still not social distancing. So now we've put in place this instruction and this directive that will be able to actually help us all implement the physical and social distancing. That is the weapon against corona.
The patient who was released is case number 2, who had been admitted at Mwangangi Isolation Unit, and we follow the WHO approved protocols which require that we do serial tests until we have 2 consecutive negative tests, and therefore the patient met that criteria after having 2 negative tests. Potentially, of course, reinfection is possible if you come into contact with another COVID case. So even if you are released from treatment or from quarantine, you are still required to follow the infection prevention control measures just like any other person.
Number 2, there are private clinics.